EMT Anatomy and Physiology Practice Test 2026 30 Hard EMT Exam Questions. Question 1. What is the first step in the primary assessment? Checking a pulse, forming a general impression, assessing the airway, looking for bleeding. The primary assessment starts with a general impression of the patient's condition. Question 2. What is the treatment for an open chest wound? A dry dressing, an occlusive dressing taped on 3 sides, a pressure bandage, no dressing. An occlusive dressing taped on 3 sides creates a one-way valve to prevent tension pneumothorax. Question 3. What is the depth of compressions for an adult during CPR? 1 inch, 1.5 inches, at least 2 inches, 3 inches. Compressions should be 2 to 2.4 inches, 5 to 6 centimeters, deep for adults. Question 4. The rule of nines is used to estimate blood loss, burn surface area, GCS score, respiratory rate. It divides the body into sections of 9% to estimate the total body surface area burned. Question 5. Where is the appendix located? Upper left quadrant, upper right quadrant, lower left quadrant, lower right quadrant. The appendix is in the RLQ. Question 6. In the U.S., what is the Ryan White Act related to? Payment for EMS, infectious disease exposure, vehicle safety, patient privacy. It mandates that EMS providers be notified if they are exposed to infectious diseases. Question 7. A 65-year-old male is complaining of pressure in his chest. You should administer oxygen and aspirin, give him water, wait for ALS, perform a head tilt chin lift. Chest pressure is a likely cardiac event. Oxygen and aspirin are standard early treatments. Question 8. A patient with pinpoint pupils and slow breathing likely has cocaine use, opioid overdose, heat stroke, dehydration. Opioid overdose presents with the triad of pinpoint pupils, respiratory depression, and coma. Question 9. Which heart chamber pumps oxygenated blood to the body? Right atrium, right ventricle, left atrium, left ventricle. The left ventricle is the strongest chamber, pumping blood through the aorta. Question 10. What is the purpose of the jaw thrust maneuver? To open the airway in trauma patients, to check for jaw fractures, to facilitate suctioning, to prevent vomiting. The jaw thrust opens the airway without moving the neck, essential for suspected spinal injuries. Question 11. What is the log roll used for? Moving a patient onto a backboard, assessing the back, both A and B treating shock. The log roll allows assessment of the spine and placement on a long board. Question 12. When suctioning an adult patient, you should limit suctioning to 5 seconds, 15 seconds, 30 seconds, no limit. Suctioning for more than 15 seconds can cause hypoxia. Question 13. Which of the following describes scope of practice? The ethical duties of an EMT, the legal limit of what an EMT can do, the location where an EMT works, a specific patient care protocol. Scope of practice defines the procedures and actions an EMT is legally allowed to perform. Question 14. Which of the following is a late sign of shock? Tachycardia, anxiety, hypotension, pale skin. Low blood pressure, hypotension, is a late and critical sign of decompensated shock. Question 15. A patient with an altered mental status and a fruity breath odor may have stroke, hyperglycemia, DKA, hypoglycemia, drug overdose. Fruity breath is a classic sign of diabetic ketoacidosis, DKA. Question 16. The golden period in trauma focuses on arrival at the hospital, surgical intervention, scene time, recovery time. The survival rate is highest if the trauma patient is in surgery within 1 hour. Question 17. A patient with stridor likely has an obstruction in the lower airway, the upper airway, the esophagus, the stomach. Stridor is a high-pitched sound indicating upper airway narrowing. Question 18. What is the definitive treatment for ventricular fibrillation? Epinephrine, CPR, defibrillation, oxygen. Defibrillation is the only way to stop VFib and restore a normal rhythm. Question 19. A patient with snoring respirations likely has fluid in the lungs, a partial airway obstruction by the tongue, asthma, a heart attack. Snoring is the sound of the tongue partially blocking the upper airway. Question 20. What does hypoxic drive refer to? High CO2 levels stimulating breathing, low oxygen levels stimulating breathing, normal breathing, exercise-induced breathing. In some COPD patients, low oxygen becomes the trigger to breathe instead of high CO2.